Good morning, everybody from Denver, and good afternoon, everybody in the UK and Europe. I want to welcome you to another edition of our Cochrane seminar series that is based out of the US network and Cochrane, Colorado. I'm Bob Della Valle, the Skin Group Joint Coordinating Editor for Cochrane and also the Colorado Cochrane Director. And I'm joined by Patricia Hain, the Deputy Director here, to welcome Richard Morley, who is a leader in our Cochrane Consumer Network and really one of the most engaging social media content posters that I've come across, either inside or outside Cochrane. So we are truly delighted to have you here, Richard. I'm going to just pass the baton, speaking stick, over to Patricia to let her welcome you as well.
Again, thank you so much for accepting our invitation. This has been a very exciting webinar series that our affiliated center has been sponsoring, and we are looking forward to your exciting presentation and to learn from you.
Thank you so much. That's really very kind of you. Thank you so much for inviting me. I feel really honoured to join you today and to speak to people in Canada and the US and the UK and further afield. So I'm going to talk to you today about embedding consumer engagement and involvement in Cochrane. I've entitled it "Welcome to the Revolution," and I hope that becomes clear why I did that as my presentation goes along. So yes, I'm Richard Morley, and it's my great privilege to work for Cochrane, for the Cochrane Central Executive Team, where I'm the Consumer Engagement Officer for Cochrane. So I work to promote involvement and engagement in evidence synthesis. I do that in a number of ways, which I'll explain shortly. I've also been a James Lind Alliance advisor, if anyone has come across the James Lind Alliance, which is it's an idea really, and a process for identifying research priorities. So I was very lucky to do that for 3 years. And before that, I worked at the University of York, which is where I live in the UK. I worked in its Department of Health Sciences and worked to deliver patient and public involvement there. Before that, I had what's called a portfolio career, I understand. I've done all kinds of things: regeneration, community economic development, So I'm relatively recent to health, but that's my background. And so I'm going to talk to you today for about 25 minutes, something like that, about involvement and engagement in research. I'm going to talk about the language that's associated with that, and describe what I understand and involvement in research is, and why we should involve healthcare consumers in research. I'm going to talk about Cochrane and its history of consumer involvement and where Cochrane stands today in its practice. I'm going to share with you some of the things that we've been doing to embed that consumer involvement in Cochrane, and talk about where we might go next. And then I'm going to come back to the revolutionary aspect of involvement. And then we can finish with some questions. I have some questions to put to you, perhaps, if people have views, ideas about involvement and engagement. So there we are. That's what I'm going to cover. So the first thing I'm going to talk about is language. So, you know, I'm sitting in the UK, and we talk about these things here in the UK. We talk about involvement of patients in health research. I'm aware, and just wanted to mention this, that's not the same language that people use everywhere. But sometimes people use the word engagement for where we would use involvement. And those things can be interchangeable in some parts of the world. We talk about healthcare consumers, we talk about patients, co-production, knowledge translation. It's a really complicated area to talk about, and it's not helped when we don't have a common language to discuss this. And I think it does lead sometimes to the potential for some misunderstanding. And I've linked at the bottom there to a blog post that I wrote with the wonderful Sarah Chapman from Cochrane UK for a Patients Included Cochrane conference 2 years ago about this and why we use the language that we do in Cochrane. This table is drawn from a paper that was published by Trish Greenhall about language and describes some of these terms and typically when and where these are used. I just wanted to say something about consumers, because people wonder why we talk about consumers in Cochrane. It's the common language you use for those people who get involved in this way. And that's because this work originated in Australia, where that term consumers is commonly used. I think it's commonly used in the US. In the UK, it's more frequently, we talk about patients or the public. So, you know, I think we'll have to live with some difficulty around the language, but I just wanted to talk about what is consumer involvement in research. And in the UK, we have the National Institute for Health Research and an organisation called Involve, which perhaps some of you have come across. It does reach out beyond the UK. And this is how Involve defines public involvement in research. They say it's research being carried out with or by members of the public rather than to, about, or for them. So that's, for example, that includes things like working with the research funders to prioritise research, like I talked about in the James Lind Alliance, or offering advice as a member of a research steering group, peer reviewing and commenting on, shaping research materials from a consumer, a patient perspective, and so on. So that's different from being the subject of research, perhaps taking part in a clinical trial, for example. So there's a difference, and that's the kind of perspective that I'm going to be talking about today. So why should we involve healthcare consumers in research? It's a question that I'm sometimes asked by researchers, and this is where perhaps sometimes it's seen as something of a revolutionary process or a disruptive process. And so I'm just going to advance three reasons. I think there are more reasons for doing it, but I'm going to talk about what Cochrane believes. So Cochrane believes that involving consumers in Cochrane's work in the way that I've described makes our work transparent and accountable, and it increases trust in the way that research is produced. And particularly at the moment when there seems to be some skepticism about the reliability of science, I think that's a really important principle for why we should involve people. Another reason that Cochrane believes that it's important is that it produces better research because it addresses things that are important to ordinary people, to consumers, to the public, and it reduces waste in research. I'll talk about that at the end of this presentation. And also, by making better research, it improves the way that it actually gets into policy and practice. And that ultimately, that means that you get better outcomes for patients. And then the third reason I'm going to mention now is that it's what's expected. You know, it's good practice. It's regarded as good practice by funders, by our partners, and by healthcare consumers themselves. So it's expected of research organisations. It's expected of Cochrane, and it is something that Cochrane has committed itself to doing. There's a lovely little cartoon there which says that the thing that patients can contribute are to do with their unique knowledge of their lived experience. You know, they have a holistic view because they have to go through a whole healthcare systems when they've got healthcare conditions. and also very often they can spot when things are not quite presented in the way that that's appropriate. So Cochrane has a long history of consumer involvement. Cochrane was established in 1993, and its work to involve consumers began the year afterwards. And I came across this rather lovely picture from quite early on in this Cochrane's work, when the consumer network, which I shall talk about shortly, was formed. So that dates back quite a long way, of a long history of consumer involvement in Cochrane. So, you know, just thinking about who those healthcare consumers are, I think they fall into different groups and different roles, but these are, you know, things that are often shared across these different roles. So for a start, and fundamentally, healthcare consumers are people who use Cochrane's evidence. In this context, I mean, it's other evidence as well, but they use Cochrane's evidence, and they're decision makers. You know, they use evidence, they come to Cochrane for evidence, often when there's uncertainty about the kinds of treatments that they're being faced with. So that's the principal reason why Cochrane exists, to produce that evidence to help people make decisions. But they're also often involved in producing Cochrane's evidence and sharing that evidence as authors, co-authors, and peer reviewers. So they're involved in the production of Cochrane's evidence. They're often involved in the way that the organization runs as well. And there's a picture here of my colleagues on the Cochrane Consumer Network Executive. And so these are people who've drawn from that group of people who are involved to help Cochrane run. They're often members and supporters of Cochrane, because now you can formally join as a member or a supporter of Cochrane. And then I'm going to talk a little bit more about the Cochrane Consumer Network, and so healthcare consumers can be a member of that particular network. What do Cochrane consumers do in Cochrane when they're involved? Well, here's a slide taken from a paper that was produced last year about the active framework. I'll talk a little bit about that shortly. So they can contribute to research, they can influence it, sometimes even controlling or leading the way that evidence is produced in Cochrane. And you can see there the wide range of ways in which consumers can contribute to research. I think this is often, for people who are doing evidence synthesis, surprising perhaps, that consumers can work alongside health researchers and can contribute a lot to the research process in these ways. Just a few facts about the numbers of people that are involved in Cochrane. So there's a Cochrane Consumer Network, which is kind of a supportive network of people who want to be involved in Cochrane. There are 1,750, as of today, 1,750 registered consumers in the Cochrane Consumer Network. They're 70% female, we know that. We believe that somewhere between 300 and 500 of them are active. That's having contributed in some way over the past 12 months. They're found across 79 countries in the world, so it's a global network. We have, as Bob said very kindly at the beginning of this presentation, we're quite active on Facebook and Twitter, on social media. And so we have 1,430 people who follow us on Facebook. And Twitter is particularly important. We've got nearly 5,500 people on Twitter, a growing community of people who are interested in health research, and try to reach out and share Cochrane evidence and other information in innovative ways. And that's one of the ways that we do it. If you're looking at the people that are involved in the Cochrane Consumer Network, you can see that most people are involved from the English-speaking world and the developed world, with the UK featuring very strongly. Second most numerous group is in the USA, and Australia and Canada. So I think some of that is historical. Some of that represents where consumer involvement is very topical and done. But it's an issue for us because I think we're missing the majority world, and that is going to introduce bias into the way that we do our research. So that's something that we need to address. And whilst I'm kind of promoting this, I feel a bit like a salesman when I'm talking about this. I just wanted to say that not everything in the way that we involve consumers is without issues. And I just wanted to draw attention to this. This is quite important. So Gerd Flodgren and her colleague did some work in 2017 to look at the involvement, the way that involvement in Cochrane reviews is reported. And what they found was quite sobering, really, that just under 10% of Cochrane protocols that they sampled, just under 15% of full reviews, that's quite a small proportion, reported consumer involvement. And only 40% of those people that did report it gave any kind of description about what that meant. Now, it may be that people are getting involved and it's not being reported, but it may also show that actually, as their poster presentation said, there's an element of talk and not followed through in terms of action as far as we would like. So since 2014, I joined Cochrane in 2014, and that was a complete coincidence, really. That was the time when we were reviewing Cochrane's strategy. We've been working to try and embed consumer involvement more deeply in the work of Cochrane. And here's a timeline for some of the things that we've been doing to show how active we have been to try and improve that practice. I'm going to just pull out one or two things to talk about. I want to talk about the Active project because this has been a really important piece of work. This was led by my excellent colleague, Alex Pollock, who's based in Scotland. And for the first time, we've described a framework for thinking about the involvement of healthcare consumers in Cochrane. And identifying when that involvement occurs throughout the research cycle, and issues like the level of control and involvement that consumers can have. It's a great paper. It's quite influential in the way that it's shaping our work, and I would urge people who are interested in this to have a look at their final report from that Active project, which will be increasingly important as time goes on. What that led to, one of the things that work led to, was this, Involving People, which is a free online learning resource for systematic review authors who want to involve people in evidence synthesis, not just Cochrane reviews, but all evidence synthesis. It's a really interesting, content-rich piece of learning with practical resources and links to concrete examples. And if anybody is thinking, I'd quite like to do some of that, I'd like to involve people more in evidence synthesis, please do go and have a look at that. It's a really fabulous resource. Another thing that's on that timeline that we've been doing in order to try and embed our involvement is this Cochrane Evidence Essentials. Again, this is another free online learning resource for people. For the public generally, for citizens, for healthcare consumers, it covers an introduction to evidence-based medicine. It covers clinical trials, evidence synthesis, and then how to understand a Cochrane review and use that in your healthcare decision making. So it's 4 online modules which are free to access, and if you Google them or look for them on the Cochrane's training website, you'll find them there. I mean, we set off to do that in order to give those people who wanted to get involved in Cochrane some information about what a Cochrane review is and how it comes into being and so on. But it has a universal it's useful for all kinds of people. Since it was launched at the end of last year, 7,500 people have used this learning. So that's very exciting. It was co-produced with healthcare consumers, and it tells, there's a journey through that knowledge. We tell the story of Eleni, who's a fictional healthcare consumer, and that's an interesting way, I think, of leading people through that learning. Another thing that I just particularly wanted to mention about the way we've been working to embed involvement is this, an international network for public involvement in health and social care research. It's mindful of the fact that our work has been concentrated very much in those parts of the world where involvement is practiced, so in the UK, the US, and so on. We worked with other partners who have an interest in spreading it more widely. And so we set up a network. It was launched a couple of years ago in the UK, and there's a picture there of its launch. There are 260 organisations who've joined that network to spread, this is the intention, to spread that idea of patient and public involvement in research, and to support people who want to do it. The principal way that we've been doing that is through a webinar program. And you can find that on the Cochrane training website. You can find historic webinars which talk about this from all kinds of different perspectives, as well as evidence synthesis, working with diverse groups, core outcome sets, all kinds of topics, interesting topics, told, I hope, in an interesting, accessible way. And hot off the press is Cochrane's knowledge translation resource that's just been launched in the past few days. And I mentioned this because consumers have a huge role to play, and it's another way of thinking about consumer involvement in terms of knowledge translation. And so this resource is really important, I think, for helping people to understand or to get involved, both as consumers themselves, but also people who want to promote consumer involvement. It's a fabulous and rather beautiful resource, only just launched. And again, you can find that either by going to the Cochrane training website or looking for knowledge translation in Cochrane and finding it there. It's open access, free to people with a Cochrane account. So I'm mindful of the time, but I just wanted to talk about where we might go next for Cochrane's involvement. At the moment, Cochrane's consulting about its strategy for after 2020. If you go to cochrane.org, you can find out more about that, and crucially, give feedback on Cochrane's strategy to tell us whether that draft is right, and I would encourage people to do that. And once that strategy has been agreed, we're going to be thinking about the consumer involvement and engagement and how that links to the post-2020 strategy. In fact, we've already been doing some work to prepare for that. We ran a survey, for example, of consumers recently to find out what they thought about the way that they were involved and the way that they engaged with Cochrane, which was an interesting. I've just pulled out some of the comments that we had there, which I think underlined some of the things I've been talking about. People are very happy and proud to be part of an organisation like Cochrane, but they're not uncritical and think that that the involvement could be done better. And that's something that we're going to be addressing, so that we can do that thing which we have there, which is about on that screen, to create a truly global community of healthcare consumers who want information that they can rely on, that addresses their needs, and that enables them to contribute to producing that. So that's the kind of vision that we have for consumer involvement in Cochrane. So I'm nearly finished now, you might be relieved to know, but I just want to say something about welcome to the revolution. I actually think that, that consumer involvement in research is a revolutionary, transformative process, a disruptive process in many ways. It's changing health research, and it should do. Interestingly, I set up a Twitter account when I was working with on some James Lind Alliance work, and I created a Twitter account. And the very first thing that somebody tweeted to me was "Welcome to the revolution," and that stayed with me ever since. To think that setting priorities in health research involving consumers and healthcare professionals was a revolutionary process, was quite an exciting way of thinking about it. It has the capacity, I think, to transform healthcare research, making it more relevant and useful in the ways that I described at the beginning. And I just wanted to mention this because I think this is waste in research is also another important way of thinking about consumer involvement. Because Chalmers and Glasgow produced some work, and have been working on this as an idea, to talk about the amount of research waste that there is. And they argue that there's up to 85% of research, 85% of research is wasted, which is a staggering amount. They calculate it as over $100 billion a year. And they advance 4 reasons for that, that the things that are being researched are not relevant. They're not relevant to clinicians, and they're not relevant to patients. And that the way the research is done is often inappropriate. That research is not necessarily accessible in its full sense, and that the way that it's reported isn't useful either. And I think there's a really important and revolutionary role here for healthcare consumers. And that's one reason why I think this is important and revolutionary. So that's it from me. There's a lot more I could have talked about, and maybe there is the opportunity for questions and discussion. I know it's not easy online, but I thought of these 4 questions that I might ask you, people who are listening. What does meaningful involvement look like? How can we engage with a more diverse and international audience? What are the barriers for you to meaningful involvement? And what can you do perhaps to help bring that about? And then for anybody who wants to follow up any of this work afterwards, or any of this conversation afterwards, at the bottom there, you can see we have a website for the consumer work, consumers.cochrane.org. There's the Cochrane.org main website, and we've got 2 Twitter accounts. There's a Cochrane Consumer, there's an unusual spelling for it, and me, RM Engagement. And please feel free to email me if any of this resonates with you, or you'd like to get involved, or you have more questions. I'd be delighted if you could write to me. So that's it from me. Thank you very much for indulging me. Thank you for inviting me. And if anybody has got any questions or thoughts, I'd be delighted to answer them.
We do have a few questions in the chat already, Richard.
Great.
And thank you for that tremendously exciting talk. I'm reminded of an ad from the 60s that the headline was, "It's a beautiful day for a revolution." So.
Yep, I agree.
But I can remember a consumer being required to be involved with every protocol and every systematic review, and that was totally mind-blowing for me as a physician coming to Cochrane and thinking that this would be required. And now it's just second nature to think, why isn't this happening more? So I do think it's a cultural shift that is slowly taking hold, and we can look at the research that you cited as saying the glass is 10% full or it's 90% empty right now. As a counterpoint, some people might argue that, well, everybody is a healthcare consumer, everybody is a patient. How do you respond to that criticism of there being so few official consumers being involved in Cochrane work currently, according to the research?
Yeah, well, yes. So there's several things in there. I think the thing to deal with the point about everyone is a healthcare consumer. I mean, I think that's true to a degree. You know, we all of us in some way access healthcare services. You don't have to be a patient necessarily. You know, as my colleagues tell me who are involved in the, you know, pregnancy issues, you know, they're not, you know, you're not ill if you're having a baby necessarily. And we all, you know, we all go to the, you know, to the physician, you know, primary healthcare provider and the dentist and so on. So, you know, yes, we all do access healthcare services. I think the thing here that that's important is about the role and the perspective that you're bringing to particular research at any particular time. So, you know, if people, for example, you know, I've been involved in healthcare priority setting, for example, and healthcare consumers were involved in that because they had a particular lived experience of that particular, you know, of that healthcare condition or of a particular health setting, and they would be involved with that perspective. And I think that's the important thing, that, you know, when healthcare consumers, when patients and carers get involved in research in the way that I've been talking, it's about their perspective and their experiences that they bring to that. So I think that's you know, that's that element of that of the point you make. I think in general terms, about why healthcare consumers aren't involved, I think that, I mean, that's an extremely complicated question, and understanding that is, you know, is problematic. I think in some cases it's a cultural thing. You know, it's perhaps not seen, you know, depending on where that research is being done, it's not even an idea in some parts of the world, you know, that research is the domain of researchers or healthcare professionals, and the idea of bringing in a patient, you know, that's just you know, unheard of, really. So it doesn't feature on people's radars at all. I think often there are issues of capacity, and in all kinds of ways. You know, people might be interested in doing it but don't know how. They might be interested in it but don't have the resources to do it, and I think that's a very common issue. You know, that people who are doing systematic reviews, certainly in Cochrane, quite a lot of those people are volunteers. You know, they're doing it in their own time. They're doing it in their evenings and so on, and they don't have the resources to go out and involve people. Yeah, so it's a complicated picture. Yeah.
Do you think involvement would benefit by a Cochrane decree that every review group have a consumer on every protocol and every review?
So that's a really interesting question. You know, Cochrane is moving in some ways to some of to that position. So, you know, for example, Cochrane now has a policy in terms of peer review that that every review should have at least one consumer peer reviewer. It's not mandatory, but it is strongly encouraged. I'm not sure about making it mandatory. I think that I think I'd much prefer it if people saw that there was a benefit to it without it being mandatory. And I think it would be very hard to make it mandatory without giving, you know, if you will the ends, you have to will the means to do it as well. And I think, you know, you'd have to tackle that resource issue as well. So, and I think perhaps if you made it mandatory, you know, there might be an element of tokenism in it. So I think, you know, it's more likely to be more meaningful if it were encouraged and people embraced it out of a sense of, you know, recognize its importance, and they were resourced to do it. Yeah.
So I want to move on to some of the questions in the chat. So are you able to see them, Richard? Would you like me to read them to you, or do you want to pick them up from the chat yourself?
Well, if you could if you could read them and kind of
That would be
curate them,
great.
that
Sure.
would be lovely. Yeah.
I'm going to start with a shorter one first from Ruti Volk. And Ruti asked you, before you asked us, sort of the same question. Can you describe what the consumer involvement looks like? What does the consumer do?
Yeah, so it's good question. I think there are lots of different ways that healthcare consumers can get involved in health research, and in Cochrane in particular. There was a slide which I very briefly kind of flashed up in front of people. So if you think about consumer involvement in the production of reviews as part of the author team, I think consumers can be having a really important role potentially to play in that, and typically that's done in areas like advisory groups. So very often people, you know, author teams will bring consumers together to advise them on the way that the review might be run and respond to their issues. And that might be things like identifying patient important outcomes in the review. It might be about the language, framing the question and making sure that the language is appropriate. They might be working alongside researchers as co-producers. I know of someone right now who's helping in the kind of searching and screening of reviews. So, you know, working as a researcher and contributing their perspective in that way. Making sure that the way that the things like the background section are written up appropriately, that the language is clear and, you know, easy for consumers to understand. So there's lots of ways in which people can contribute in terms of authoring. There are other ways that people can get involved. So, for example, some Cochrane review groups, editorial groups, are running priority setting exercises that can involve healthcare consumers in identifying important research that should be done. In governance, so there are lots of ways that consumers get involved. You know, we have 2 consumers who sit on Cochrane's council, and we have consumers who take part in the Cochrane Consumer Network Executive, and there are, you know, across Cochrane, there are consumers who help review groups in the way that they're run as well. So there are lots and lots of different ways. If you go to the active paper that I described, which was published last year with Alex Pollock as the lead author, it you know, part of that work involved a systematic review where we looked systematically to find that the ways that consumers are involved and describe that fully. Yeah.
So at 9:24 here in Denver, Amy Bergeron asked, she said she would love to know whether the Cochrane Consumer Network reporting standards for public involvement in research. She's familiar with the GRIP2 reporting checklist from the BMJ 2017, but is curious if this is what you would recommend.
Right. Yeah, several things in there. I mean, thanks for that question. That's a really great question. The Cochrane Consumer Network, I think, is a unique feature in across the world, actually, to have a network of volunteers that work in that way. I'm not aware of anything quite the same. So that's a fabulous thing to celebrate that Cochrane established. And from that membership of 1,750 people is drawn a group that form part of an executive, and they exist to kind of promote involvement, to encourage people to get involved and to support them as individuals, but also to encourage Cochrane and to advise Cochrane on how that should be done. They have a huge task to do, Cochrane being a huge organization and, you know, multifaceted and so on, and there are lots of demands placed on their time, but they've been involved in many of the things that I talked about earlier. So they have been involved in trying to improve the way that Cochrane does its involvement work. We haven't gone as far as standards yet. So standards is an issue. In the UK, they have been adopting standards for involvement. And that might be something that we come to later. There's an issue about, which kind of relates to the question that you asked, Bob, about, you know, making it compulsory and so on. We've not got there yet to standards, but I think it might be something that we would do that at some point. One of the important issues in that question is about reporting involvement. And there was a paper by Flodgren and Bedondi, which I referred to, and, you know, they said, well, you know, I can't remember, 10% of reviews report consumer involvement, and actually there is no standard for reporting of involvement. We haven't adopted that yet, and that makes it very difficult to understand the extent to which consumers are involved. We do, in that involving people resource, we do talk about the GRIP reporting process, which wasn't designed specifically for evidence synthesis, but, you know, you could look at that and use that. But just yesterday, I was on a call with a group of editors and others who are going to trial, you know, design a process for reporting and adopt it just for themselves, for their 2 review groups, with a view to, you know, encouraging people to move to a more consistent way, a standard of reporting. Yeah, I think that would be really important. You know, Cochrane has standards, messier standards, and, you know, that's something that we could add to in time, I think. It's a work in progress.
Okay, I just want to pass along a message from Nina McHale that this session is being recorded and that all attendees will be receiving a link following the session. We've had up to 40 people on the line today, so thank you all for joining us today. Yeah. We have a few more questions here, Richard, if you have the time.
I absolutely do. That's
okay,
fantastic.
Wonderful. So a question and observation from Dalia Moore-Elzeki, pardon my butchering the name.
Dalal.
Pop it up. You've got access to the microphone. She writes, regarding barriers in general, on all levels, there is more talk than action so far. Institutional buy-in than practical. Do you have any advice on how librarians working in hospital contexts directly with healthcare professionals or patients can better promote the involvement of healthcare consumers in research within their institutions? What roles can you envision?
Wow. Well, first of all, thank you very much for the question. That's a really interesting question. And I'm sorry that your experience isn't as positive as it might have been. I think sadly, it's not an uncommon experience that consumer involvement isn't necessarily an idea that's bought into by all kinds of institutions. It's disappointing. And I wish more institutions would embrace it. I'd have to say I'm not familiar with particularly with how librarians, medical librarians work in a hospital context. I'm not, that's not something I'm especially familiar with. I've worked in a university, and I've worked in Cochrane. So my experiences there in the university, for example, in the health science department, was that the most important thing that concentrated people's minds on it was the way that this was the attitude of research funders, and where research funders required people to involve consumers, that concentrated people's minds. So there's a role there for, I guess, for engaging with research funders to try and persuade them to make sure that it's at least explaining your plans is part of that. So I don't know how that would work necessarily in a hospital, but that was something that was really important in my experience in the University of York. The other thing that we did was we got people within the university, within the Department of Health Sciences together. This is some work that I was involved in. So we got those people who were interested in this as an idea. We got them together, and we formed a group of people who were practitioners, who were interested in it, who wanted to promote it and support it. And so we set up a group of like-minded individuals, and we worked with senior managers in that department. In fact, they came along and took part in it to promote it and support it, to set up resources, to set aside time to discuss it, to look at how it was being done, to champion it within that department. I don't know if is any of that any help. I'm not sure. To be honest, I think you would probably know more about it than I would in this particular context.
Am I allowed to talk? I'm
Yes,
already talking.
yes, go ahead.
Go ahead.
Thank you so much for your response. I think that our context, I'll just give a bit of information. So as librarians on the medical side of things, we actually support the development of systematic reviews. We not only do that bit of research and then send it their way, but we're part of that process from the beginning. So
yep.
Having a role in recommending the involvement of consumers is something that librarians could potentially do. It's just
yep.
something that has to be supported institutionally or have buy-in, as far as I see. On the other hand, we have many patient resource centers or patient information centers that exist that could also connect patients with professionals, or at least help to empower patients to be those healthcare consumers we want them to be, to let them know that this is part of their role. It's something we do on a very small level, but it would be fantastic if it could be done on a larger level. So I guess I wonder what Cochrane librarians are doing in this initiative and how they're involved. Perhaps they would have some insights. Anyway, that's where my brainstorm was going. I'll stop now.
That's really interesting. Yeah, I think that perhaps there may well be some Cochrane librarians or information specialists on the call. It'd be good to hear from them and to hear about their experiences. I mean, they're they're part of the author teams, and I think very often, one of a collective response to a group of people. Producing a systematic review is a team activity, isn't it? And working alongside consumers and getting them involved in their particular discipline. Like I was talking, someone I was talking to just this week, who's helping to help to set the search strategy, and who's doing part of the screening for reviews and so on. I think there are lots of ways to involve them and to open up that process to other people. Yeah.
Thank you, Dahiel, for that comment.
Thank you.
She also has a shout out regarding Cochrane Consumer is doing translations, especially the French summary, plain language summaries. She says those are a delight.
Oh, that's fabulous to hear. I know it's an increasing part of Cochrane's work translating into other languages, and it's considerably increased the extent to which our research is available. Yeah.
So,
Thanks, Dan.
Richard, the COVID crisis has changed the way Cochrane operates in terms of the speed at which it's churning out important systematic reviews with regard to the pandemic. Have consumers been involved in that recent revolution within Cochrane?
Yes, they have. It's a great question, and I'm glad you asked me about that, because yes, yeah, I mean, the pandemic's changed everything, hasn't it? And Cochrane has responded to it as well, by undertaking a whole series of rapid reviews, and also advancing some reviews which were kind of more standard reviews, and that's going to change the way that Cochrane works for some time. So when that happened, there was a question really that was asked of us, and I think it was asked of all forms of research as well, was would researchers continue to involve consumers, or would it be seen as something that was perhaps too hard to ask people to respond in those timescales, or was it always optional? And I think certainly from the UK, the evidence was that consumer involvement really dropped off when the pandemic hit. But we were determined in Cochrane that wouldn't happen. We wanted to give people a voice, consumers a voice in this, and I particularly want to shout out to my colleague Luba Litvan, who is in Canada, who's been involved in the BMJ Wikirex Magic app work, who in particular was very persuasive, articulate, that we shouldn't leave those behind. So what we set up essentially was a rapid response consumer group. So what we did was we got together a task group of people who wanted to help set up a process that could so that people could get involved. And we very quickly put together lots of resources which explained the rapid review process and explained how consumers could get involved. So there were resources for consumers, but also resources for researchers as well. And we pulled together some one pages. We recorded some audio and video for people who wanted to get involved. And we recruited 108 people who've been taking part in rapid reviews, Cochrane's rapid reviews. It's been a privilege to be working with people in this difficult circumstances, to give a voice to those people who either have experienced COVID or just wanted to support that process. To date, they've been part of 20 systematic reviews. 4 of those have been where they've worked alongside as part of the author team. The others have been about peer review, and we're also in the process of supporting other work. So the Magic App Wikirex process, and development of an Australian guideline, and now the COVID End partnership work that's being led by McMaster in Canada. So yeah, it's particularly pleasing to see that consumers can and will give their time voluntarily to contribute in a way that's really useful in that kind of rapid response process.
Can you just fill us in a little bit more on the Wikirex Magic App, what that is and what it does?
Yeah, so I'm not overly familiar with it, but they produce guidelines. They do it in a very rapid way, very focused way to get the answers to questions that are important in real time. and they produced, I think, very well received guidelines for healthcare professionals principally, and they have been very Liuba has been very active in involving consumers in that in a very focused way. So she was able to bring that experience of rapid guideline development to the work that we've been doing.
Before we let you out of the hot seat, I want to ask what you're doing with regard to and consumers in general are doing for strategy development for the Cochrane now that we're developing our strategy for the next 5 years.
Right. Yeah. Good question. Yeah, Cochrane's has a strategy to 2020, which has been guiding its work since for about 5 or 6 years. That runs out shortly. They've produced a draft strategy, which is out for consultation now. And so anyone can go on to cochrane.org to have a look at that and comment. Consumers clearly have an interest in that. And we've done a number of things. So we've just, was it last week or the week before, we ran a consultation event for consumers online where we explained that process to people. And we talked about the way that consumers can add value to the Cochrane strategy and how it can relate to their work. Or does the draft do that? We've written out to all of our consumer network with information about that and how they can get involved in responding to it. Our Cochrane Consumer Network executive is in the process of writing a response to it to make sure that that their concerns, their issues are taken into account in the draft. And also the Cochrane Council, which includes 2 Cochrane consumers, are going to be making a response to the strategy as well. And we hope to feed that in before the end of the month. So we've been very active in engaging with consumers and trying to make sure that their views are heard when this draft while this consultation is going ahead.
We have one more question that's come in from the chat. This will be our final question from the chat. It's from Patty Hain, who asks about the approaches used to ensure appropriate representation, diversity, and inclusion.
Yeah, it's a really good question. And I think, we have quite a lot of ground to make up in that respect. I think I shared some things earlier about for example the way that our volunteering community is very much skewed towards the English speaking world, the developed world, and so we know we need to do better. We need to reach out more globally. We've been doing a number of things. So, for example, recently we've tried to recruit to our consumer executive, and we wanted to, as part of that, we're still doing that. We wanted to make sure that we have more diverse representation on our executive group. We've been doing some work to promote engagement and involvement across our global network of geographic centers as well, because it's important that we reach out to parts of the world where Cochrane hasn't necessarily been as active in the past in terms of this engagement work. So we set up a £10,000 fund to encourage Cochrane geographic groups to try new innovative work in reaching out to those parts of the world and those communities, particularly low and middle income countries. So that's another way that we've been trying to reach out to a more diverse audience. It's something that Cochrane as a whole is concerned about, and it was a theme for last year's colloquium, which sadly didn't go ahead because it was in Chile just at the time, and there was a lot of issues. So, but it is an issue, and we know that we have to take this more seriously, and we will be bringing more work forward on, to do that.
Well, thank you so much for joining us. We're at the top of the hour, Richard. This has been a very entertaining and informative session. I want to thank you again for joining us. And I want to pass the speaking baton to Patricia Hain to let her thank you as well.
Thank you so much, Richard. What such a wonderful, rich presentation. I'm sure everyone learned a lot today. And so we are looking forward to keep learning about the developments. And so hopefully you come back next year and incite us about all the new developments. And I will keep an eye and keep participating as well in your group that is doing such a great and important work. So thank you so much for all your service and everything you do.
Oh, thank you so much for inviting me, and thank you for everyone who came to listen. I'm just so pleased, and thank you for the comments in the chat box. And please, if anybody is interested, I'd be delighted if people contacted me to talk more about it. So thank you so much. I'm delighted to have been invited.
Thank you, Richard. Thank you, everyone.
Thank
Look
you.
forward to the link. Talk to you next month.
Thank you. Bye-bye.
Bye-bye. Thank you so much. Bye, everyone.